The American Cancer Society says by the end of this year, more than 300,000 new cases of invasive breast cancer are expected to be diagnosed in women across the United States. Dr. Abdallah Sholi, a medical oncologist with UPMC Hillman Cancer Center in Williamsport, says there are a few known and established risk factors for breast cancer. He says most people think about their genetic and family history, especially if you have a genetic mutation that puts you at a higher risk.
If you are exposed to hormonal and so if you take any kind of hormone replacement therapies, if you started menstruating as a female below 12, if you had no breastfeeding, if you had your first child a little bit older, although it's not old, above 30, that's always a risk factor.
Dr. Sholi says being a woman and older puts you at a higher risk, as does alcohol use and being exposed to radiation. Experts say breast cancer treatment has been evolving over the years. Dr. Sholi says every patient is different.
If you are estrogen receptor positive, if you have what we call a HER2 positive, if you're HER2 new positive, if you are a triple negative, if you have one of those abnormal genetic mutations, if you have certain genetic abnormalities in the cancer that will change the approach how we treat the breast cancer.
Dr. Sholi says here at UPMC, they can go a little bit deeper and look for certain genetic mutations in the cancer through what is called next-gen sequencing.
That will help us to identify any mutation that developed in your breast cancer that we could try to target with either an oral form of treatment or intravenous or sometimes immunotherapy or target therapy or antibody drug.
Dr. Sholi says UPMC has more than 400 trials available. He says patients are participating in the most updated treatment for any type of cancer.
It will compare the standard of care versus a newer approach. And a lot of times, a lot of those newer approaches, you cannot really access them because they're still on trial unless you go on a trial. So we do hopefully have those available for a lot of patients.
Dr. Sholi says UPMC also offers survivorship care. The program covers health, social, and financial causes, as well as the physical therapy and nutritional help. For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.